Bismillahirrahmanirrahim. CME update by Mother and Child Survival Group of Pakistan. Me, Dr. Tariq, Ops Gynae Family Emergency Specialist, Gulf KSC, SPR OBG UK, and presently working as District Gynecologist, a physician. We would like to add some MCQs for the practice for the members and the fellows preparing for their final examination. So, Alhamdulillah, we start with the first scenario. A 32-year-old female presents with 2 months history of breathlessness, tachycardia, and menstrual irregularity. Her investigation revealed serum HCG negative, serum T4 178, TSH 0.005, prolactin 400. What is the most likely diagnosis? Options are primary hypothyroidism, B, A, primary hypothyroidism, B, Graves' disease, C, Hashimoto's thyroiditis, D, multinodular goiter, E, Cohen's thyroiditis. So answer is Graves' disease. The second MCQ, the probability of sarcomatous change occurring in fibroid is option A 0.1%, B 1%, C 5%, D 10%, E 15%. So answer is the probability of sarcomatous change occurring in fibroid is 0.1%. Third, what part of embryo is the origin of primordial germ cell? What part of embryo is the origin of primordial germ cells? Number 1A, gonadal ridge, B, yolk sac endothelium, C, coelomic epithelium, D, extraembryonic mesoderm, E, primitive sex cord. So the answer to this question is, what part of embryo is the origin of primordial germ cells is yolk sac endothelium. Fourth, very important MCQs for FCPS 2, MRCOG 2 or 1. The greater omentum is derived from which of the following embryonic structure? I repeat, the greater omentum is derived from which of the following embryonic structure? A, dorsal mesoduodenum, B, dorsal mesogastrium, C, pericardioperitoneal canal, D, pleuropericardial membranes, E, ventral mesentery. So the answer, the greater omentum is derived from which of the following embryonic structure is the dorsal mesogastrium. What electrolyte imbalance can cause paralytic ileus? A very important question and has been repeated many a times in fellowships and in memberships, Option Gynae, and in others as well. What electrolyte imbalance can cause paralytic ileus? Number 1, hypernatremia, B, hyperkalemia, C, hypocalcemia, D, hyponatremia, E. Hypokalemia. So the answer is, what electrolyte imbalance can cause paralytic ileus is hypokalemia. Low level of potassium causes paralytic ileus. Next MCQ, still very important. Vasopressin act on increasing water reabsorption at A. proximal tubule, B. loop of Henle, C. distal convoluted tubules, D. collecting duct. So vasopressin act on increasing water reabsorption at collecting duct. Very, very important. Now, another important MCQ, placement of cup during ventouse delivery when the neck is flexed. Very trick is there, much trick is there. Placement of cup during ventouse delivery when the neck is flexed. A. sagittal, B. coronal, C. temporal, D. frontal, E. lambdoid. So the answer is, placement of cup during ventouse delivery when the neck is flexed is sagittal suture. So sagittal suture is the answer. The placement of cup during ventouse delivery when the neck is flexed. Another MCQ, muscle found in the scrotum. A. tunica albuginea, B. dartus MS, C. tunica vaginalis. So the answer to this question is a very important question. The muscle found in the scrotum is dartus muscle. Dartus muscle is the muscle found in the scrotum. Now another MCQ, angle of the vagina with the horizontal while standing. Angle of the vagina with the horizontal while standing. A. 45, B. 60, C. 70, D. 80, and E. 90. Angle of the vagina when horizontal while standing is 60. Is 60 the angle of vagina while standing? Angle of vagina with the horizontal while standing. Another MCQ, joint which resist horizontal rotation of the pelvis. Joint which resist horizontal rotation of the pelvis. Number 1, sacroiliac. Number 2, sacrospinous. Number 3, iliolumbar. D, sacrotuberous. So the answer to this question, a joint which resist horizontal rotation of the pelvis, joint which resist the horizontal rotation of the pelvis is iliolumbar joint. Two most common dermatitis in pregnancy. Another question is, two most common dermatitis in pregnancy. A. atrophic dermatitis plus polymorphic of pruritus of pregnancy, PUP. B. postula and plus cholestasis. 3. Pemphigoid and cholestasis. Polymorphic PUPP plus pemphigoid, fourth one. And fifth one is polymorphic PUPP plus obstetric cholestasis. The most common dermatitis in pregnancy is among all these is obstetric cholestasis, which is very common, in which the alanine transferase and the others and the bile acids are increased. Another question is, what most common protozoan causes zoonotic infection, cerebral calcification, retinitis? Very important question. Most common protozoan causes zoonotic infection means cerebral calcification with retinitis. Option A, chlamydia, B, plasmodium, C, toxoplasmosis, trichomonas, fifth, giardia lamblia. And the answer to this most common protozoan causes zoonotic infection, that is cerebral calcification and retinitis, is toxoplasmosis, toxoplasma. Paroxetine is teratogenic to which organ? Paroxetine is an antidepressant of SSRI group. Is teratogenic to which organ? I repeat the options: CVS, CNS, craniofacial, limb, kidneys. So the answer, paroxetine, which is an antidepressant, is teratogenic to which organ? The answer is CVS, cardiovascular system. Another MCQ is, these are very, very important MCQs. Believe me, if you want to remain focused, solve these MCQs with their explanations, as I tell you that these MCQs are repeated in both fellowship and memberships. It's my also personal experience. Another MCQ, which electrolyte is involved in central pontine myelonesis due to fluid overload? Very important MCQ. Which electrolyte is involved in central pontine myelonesis due to fluid overload? Options: potassium, B, sodium, calcium, magnesium, and chloride. The answer to this is, which electrolyte is involved in central pontine myelonesis due to fluid overload? So it is sodium. Sodium is the electrolyte which is responsible, which is involved in central pontine myelonesis due to fluid overload. Another MCQ, vitamin E, toxicity, dementia, hemorrhage, renal failure, cardiomyopathy, lung fibrosis. Well, the answer is, from all these options of dementia, hemorrhage, renal failure, cardiomyopathy, and lung fibrosis, it is hemorrhage. Vitamin E toxicity is hemorrhage. Another important MCQ, homologous of round ligament in males. Homologous of round ligament in males. A. Vas deferens. B. Gubernaculum. C. Reti testis. The answer to this, that homologs of round ligament in male is gubernaculum. Another MCQ, very important, origin of obturator artery. Origin of obturator artery. The options are internal iliac artery, external iliac artery, common iliac artery, deep circumflex iliac artery, and femoral artery. Internal, external iliac, common iliac, deep circumflex iliac, and femoral. The answer is obturator artery originates from the internal iliac artery. Another MCQ, also important, at term G2 wearing seat belt car accident, she has abdominal pain and consults you for anti-D. At term a gravida 2 wearing seat belt has car accident, has abdominal pain and consults you for anti-D. Number 1, she does not need. Number 2, anti-D 250 international unit. 3, anti-D 500 international units. 4, anti-D 1500 international units. 5, perform Kleehor-Beck test. Answer to this is at term G gravida 2 wearing seat belt has a car accident and she has abdominal pain and consults you for anti-D. The answer is anti-D 500 international unit. Answer is 500, anti-D 500 international units. Another very important questions. Deltaprin, a low molecular weight heparin, is measured using. Deltaprin is a low molecular weight heparin, is measured using, very important, APTT, PTINR, anti-factor 10th A activity. Deltaprin, a low molecular weight heparin, is measured using APTT, PTINR, and anti-factor 10th A activity. So deltaprin, a low molecular weight heparin, is measured using anti-factor 10th A activity. So another MCQ, very important, by the Mother and Child Survival Group of Pakistan for both fellowships and membership examinations. Congenital conjunctivitis organism, purulent discharge 36 hours after birth. Scenario is a congenital conjunctival organism, congenital conjunctivitis organism, purulent discharge 36 hours after birth. Number 1, chlamydia trachomatis. Number 2, Neisseria gonorrhea. So, ladies and gentlemen, the answer is the chlamydia trachomatis is the congenital conjunctivitis organism with purulent discharge 36 hours after that. Another MCQ, piezoelectric used in piezoelectric used in? This is related from imaging. Options are piezoelectric used in. Options are MRI, PET, ultrasound, X-ray, CT scan. Piezoelectric used in MRI, PET scan, ultrasound, X-ray and CT scan. So the answer is piezoelectric used in ultrasound. Another very important MCQ, transformation zone. Number 1, glandular to squamous metaplasia. Glandular to squamous dysplasia. Squamous to glandular dysplasia and squamous to glandular metaplasia. So the transformation zone is squamous to glandular metaplasia. Thank you very much for the patience listening. We'll come with another CME update, and we must takeaway is pray, praise, trust, love, worship Allah, follow Rasulullah sallallahu alaihi wasallam, our health and survival. So we must not forget our glorious past. दी अजानें कभी यूरोप के कलीसाओं में, कभी तपते हुए सहराओं में, दश्त तो दश रहे दरिया भी ना छोड़े हमने, बहरे जुल्मात में दौड़ा दिए घोड़े हमने. And we must always pray La ilaha illallah Muhammadur Rasulullah.